of all, it's not something to discuss, because health is a human right. It's the basic thing we must provide to everyone in an equitable manner. So at least we all agree with that. Closer to half of diseases that are a concern for the world are actually located on this continent, only this continent. And yet, we provide 1% of the solutions to those diseases. We in Africa consume more than 8% of vaccine, and we produce so far only around 1%, 2%, and only one type of vaccine produced here, yellow fever, in Senegal and South Africa. We in Africa contribute 2% of the global research output. 2%, 1-2. It was actually 1% 5 years ago. So within 5 years, it has moved from 1 to 2%. So you can imagine, you take another 5 or 10 years to move to 3% and so on. So this statistic, this number, always make me think of how even science, the basic thing that people would share, invest, it's only concentrated in one place where there are less diseases, there are less problems. And yet, where the problems are, there are no solutions. The problem is here, but the solution is here. So how do we bring these things together? Is by creating these research centers you mentioned. Is by training people capable of conducting quality trials, quality research, where the problem is. You don't want Africa or young researchers in Africa being just data collectors for researchers somewhere in big universities, and they publish those data from Africa, from these small health centers, collected by people struggling even to treat patients for their academic interests. Health data repository, access even to data, to information, has been a challenge. Those articles that are being published in big journals that has existed for 100 or 200 years are not even accessible to that person who collected the data in a small health center somewhere in West, East, or South Africa. You have to pay to access your own data published in the journal by scientists who never came to help you to collect the data. Can you imagine that? You have to pay to access your own data you collected for people, for institutions that are not helping you to even build your own local capacity. That is a big issue. I'm glad you're thinking about it. This data repository is access to data that are helping you to implement better policies and actions to reduce the disease burden to our communities. Last is leadership, not least. Leadership is key. It's governance. Leadership starts from the local communities to our health systems to our own institutions. And this is also a driving force for all these changes that we need to build. It's a leadership academy to have young people who are thinking that what they have experienced in 2022, 2023 is not going to be the same in 2030 or 2040 when we have all retired. That our next generation should not be experiencing, speaking the same statistics that I'm sharing with you today.